Medicare Advantage plans, what are they and why should I care? And why is everybody trying to get me into a Medicare Advantage plan? Okay, this is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute, and we're going to talk about this. This is video number 4 in a series that I'm doing on the Medicare and You Handbook 2020. I read it so you don't have to. Original Medicare, which was the video I did right before this, video number 3, has 4 pages devoted to it. Out of 125 pages in the Medicare and You Handbook, there's 4 pages devoted to Original Medicare. There's also 4 pages devoted to Medicare Supplement. Medicare Advantage, on the other hand, has 14 pages. Why is that? Is it a little more complicated? Well, actually, it's a lot more complicated. With Original Medicare, you'll remember there are no networks, there's no referrals, you have unfettered access to health care. You can go to any doctor, any hospital, anywhere in the country. That's not exactly the case with the Medicare Advantage plan. They are all managed care plans. They're either HMO or PPO. In Georgia, about half the plans are HMO. A little over half the plan are HMO, and they don't have a premium. The rest are PPO plans, and most of those have premiums ranging anywhere from about $30, $40 a month to over $100 a month. The interesting thing is a lot of agents that push the Medicare Advantage plans say that, well, my clients can't afford a Medicare supplement plan. Did you really ask? Well, no, they just don't make a lot of money. Okay, well, I do things a little bit differently. I have been in the health insurance business for over 45 years. I was in the health insurance business long before managed care came along with the HMOs and PPOs and so forth. And the biggest headache that I had in dealing with clients that were on managed care plans was, well, I went to the doctor that was in the network, went to the hospital that was in the network, but the doctor in the ER was not, and so I'm getting all these bills I'm getting hammered with. Or I went in for surgery and I made sure that the surgeon and the hospital were in network, but lo and behold, the assistant surgeon was not in network and neither was the anesthesiologist. So again, surprise bills. All right, you won't have that with Original Medicare. Medicare Advantage plans are managed care. You may run into situations where one or more of the providers that you see are in network and some of the others are not. And that's not, when you're recovering from an illness, that's not the time to learn that the plan didn't work exactly the way you thought it would. So, why is there 14 pages in the Medicare and You Handbook about Medicare Advantage plans? Well, there's a lot of moving parts to them. And most folks don't understand them until they actually use them. And at that time, if they're dissatisfied, well, it's probably too late to get out of an Advantage plan and pick up a Medicare supplement plan. There's a lot of different rules about when you can enroll in a Medicare Advantage plan, when you can leave the plan, and where you can go once you do decide to leave them. It's pretty much it's what I call the private Benjamin moment. Goldie Hawn thought that she'd joined the army with the yachts and the condos and everything was going to be great, and then she realized, well, it's not exactly that way. And a lot of folks that get into Medicare Advantage plans, they have their own private Benjamin moment where they said, well, wait a minute, I thought everything was supposed to be free. I thought I could see anybody I want. What do you mean I can't do this, I can't do that, and I have to follow some stupid rules? This is my health we're talking about. Okay, the Medicare Advantage plans do have a lot of moving parts. Good news is you get to change them every year. Bad news is you can only change them during open enrollment in most cases. There's a couple of situations that will come up where you can make changes, but those usually involve moving to someplace else. so that you can get into another Medicare Advantage plan in most cases. It's very easy to get into a Medicare Advantage plan. It's very difficult to leave one and go into a Medicare supplement plan. It's kind of like the Eagles song, Hotel California. You can check out, but you can never leave. Pretty much the same way with a lot of Medicare Advantage plans. So just know what you're getting into. Go into it with your eyes wide open and understand that this is managed care, that you got to play by their rules, not your rules. You can't make them up as you go along. You have to understand, what's out there. And the other thing is, of course, most of the Medicare Advantage plans, at least the ones in Georgia in 2020, will cap your out-of-pocket at $6,700. Now, keep in mind that's just for in-network approved health care claims. Does not include prescription drugs, does not include out-of-network claims. It does not include claims that are not approved by your Medicare Advantage carrier. So just beware and understand. And, if you want a Medicare Advantage plan, that's great. Just don't drag me into this. I'm on Medicare myself. I have original Medicare and a supplement plan. I wouldn't have it any other way. I have over 500 clients in Georgia. I've been working the Medicare market for the last 10 years. Prior to that, I set up group insurance plans and individual health insurance plans for people under 65. But for the last 10 years, my focus has been strictly on Medicare. Every one of my clients have original Medicare and a supplement plan. That's the way they like it, that's the way I like it, and that's the way it's going to be. So I'm not saying the Medicare Advantage plans are wrong. I'm just saying understand what you're getting into, and don't just jump because it is so attractive. Well, gosh, they've got everything. They've got dental, they got vision, they got this and that and so forth. And on top of that, I don't have to pay a premium. Just remember this. If it sounds too good to be true, it probably is. And go into it with your eyes wide open. If you got questions about Medicare and specifically about Medicare Advantage plans, give me a call, shoot me an email. I am Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care. Have a great day.